Well, in our household, I am overrun by men. And they're like, oh, we talk about is women's health. And I was like, great, you should be talking about it with your friends and colleagues. So
Yeah.
um, it is getting more airtime and more conversation and more headlines. But I still think there are ongoing gaps. And I'm glad that we're working to try to address them.
Hello, and welcome to Beyond the Benefits. This is a podcast exploring flaws in our healthcare system and the people fighting to fix them. I'm your host, Chris Reed, and I'm really excited for today's conversation. Last fall, we shared 6 emotional member stories about the importance of personalized navigation. We're going to pivot a little bit this year and really focus on thought leadership, talking with experts and innovators on every aspect of healthcare. I'm thrilled to kick off this season today with 2 icons in the healthcare industry. We're here to discuss the importance and evolution of women's health. First, we're joined by someone I greatly admire and have had the privilege of learning from during my career at Quantum Health, Trott. She's not only a best-selling author and founder of Quantum Health, but she's also a culture builder, an empathetic leader, and an overall really good person. Thanks for joining us today, Kara.
Thanks, Chris.
We're also joined by Dr. Janet Choi. She's the Chief Medical Officer of Progyny and an experienced podcast host herself. Dr. Choi is a double board certified reproductive endocrinologist and OBGYN and overall women's health champion. Thanks for kicking off the season with us, Dr. Choi.
Thanks so much for inviting me, Chris. I'm so honored to be on this podcast with you and Kara.
Oh, we're really excited to have you. So let's go ahead and dive right in. From your perspective, Kara, how has the conversation around women's health changed over the course of your career?
I'll start by saying I'm really old. So it's changed a lot. And I remember, when I first started working in it, I don't think we recognized that there were differences between men and women. It wasn't well recognized in the medical space, I would say. So there's a lot more awareness of differences between men and women, things like heart disease, even things about how we metabolize medication, all sorts of things women do differently. And so many things have historically been tested on groups of men and then applied to women. There's a lot more research, like the American Heart Association has recently created a big venture fund to do specific research on heart disease for women, which presents very differently. I also have noticed, though, over the years that there's a lot more vulnerability for women. I came in, and I was a teenager when Roe v. Wade was passed, so I grew up in an era where you had reproductive freedom, and that has now obviously changed dramatically. So that's a big difference from where we were. So many things are moving forward, and some things are getting more constrained, and probably not a political statement, but as a medical in the healthcare profession, it's actually not as consistent state by state as it would be. It's become politicized.
Dr. Choi?
Just to add on to the astute observations that Kara made, I think when you look back at the history of women's health in the U.S., we're still kind of playing catch up. But I'm excited to talk about in this podcast the things that we're doing right as we evolve. Just like milestones that we're probably all familiar with. It was as recently as 1993 that the NIH changed course and actually required that women be included as subjects in studies on clinical trials ongoing so we can better understand how health conditions, how drugs impact women in all these trials. For me as a reproductive endocrinologist, I was floored because I had been taking care of patients for over 2.5 decades in this area. To realize that it wasn't until less than 10 years ago, 2017, that the World Health Organization recognized infertility as an actual medical condition. So I think there is some catch up. There's alterations in our lexicon, broadening understanding education. What I find exciting is the benefits and the changes that are ongoing are not just due to leaders like Kara and your team and my colleagues at Progyny, but also when you look at the patient populations themselves, I find it very exciting. There seems to be more of a public voice, more active advocacy from the women who are demanding better healthcare and better services. And I think although there still is embarrassment and shame in terms of talking about different aspects of women's healthcare, and I agree wholeheartedly with Kara that I think inappropriately, this medical arena, women's health, has been politicized, which has impacted the ability to access really great quality care. In certain instances, I think overall, when you look at the degree of advocacy, just demanding change that's better, I find it very exciting.
Yeah, it is really surprising to hear that in the last 10 years, infertility was defined as a
I
medical
know
condition.
it's kind of
That's wild.
mind blowing.
I I guess any either one of you have any perspective on why you think, what kind of obstacles were in the way to um, get to some of these advancements? Like any perspective on the hurdles that we faced along the way? Like what's your take on that, Kara?
Well, I mean, I think if you go back way deep in history, most doctors were men, and when you had female patients, social mores didn't even enable men to really touch women. So there were very limited approaches to just even doing physical exams, and treatment of things like breast cancer was really archaic. And so you come out of that era into an era of, more equality and more recognition that women have issues, and we don't need to be bound by some of these, old ways of doing things. And, you know, then we start treating women similar to men. But it actually, I think there's much more research now and much more awareness that women are different. Just our biological and physiological makeup is different. So now you have awareness, which everything starts with awareness and questions. You have a lot of advocacy out there. You have funding that's now going to women's health research in all sorts of different areas, and recognition even that diseases like cancer aren't contained to just treating the cancer itself, because treating cancer causes other things to happen and change within the body, like infertility happening as a result of cancer treatment. So there's even recognition that women's health issues, such as fertility and things like that, get impacted by other forms of treatment. It actually need to be included in the comprehensive protocol. Like I said, I mean, I just only because I'm going to it tomorrow, is the Big Go Red event.
That's
And women's heart disease, number one killer of women. Nobody would think that, but it is. And it presents so differently. And it's often a problem even during pregnancy. It's a temporary problem, but it can kill the mother. And, we just really haven't recognized all of those kinds of permutations of this disease. And it's really great to see so much money and research and support and recognition going to it. It's going to benefit all of us. Because I always say, men are sons, right? Every man has a mother. Men have wives, they have sisters. They care deeply about making sure women get cared for in the right way. So this isn't a gender issue or a sociology problem. It's a real medical issue, and I'm glad to see us embracing it at all.
Dr. Choi, I'm curious your take on, you know, does this feel like a longer term shift from your opinion, like to prioritizing women's health and not just a short term trend?
again, you might be talking to a very biased responder because I'm a gynecologist, and very, feel very passionately about this. I do have seen over the past decades or so, there seems to be a positive shift overall in terms of, at least if even if not better understanding, a growing desire to understand how best to address women's health. Um, and I hear it frequently from our partners, from our clients, that top of mind women's health related needs, specifically frequently because they're looking at how to contain costs, maternity spend, and we can spend an entire podcast or two or three talking about that. How to best address those needs before these crisis events occur. I also think that, and I find very interesting and also very important, there seems to be a growing focus on how can we prevent, what can we do by looking at women's health and connect the dots with sentinel health events, and even before an acute event crisis occurs, what can we do upstream when a woman is younger to try to educate, intervene, hopefully with lower cost treatments or counseling or medical visits to prevent later life health events. One example is, I think there are increasing studies to tie in with Go Red and women's heart disease, are that is now the understanding that pregnancy-associated events like preeclampsia, the sudden onset of really sometimes dangerously high blood pressure and other can affect other organs, can actually translate to a higher risk for cardiovascular disease in midlife. And so being able to sort of piece that together and try to intervene in the postpartum period to try to minimize later life cardiovascular disease events is really, really vitally important. Not just for the woman herself, but for the family that she is part of and for the company or the organization that she works with and for. So that's why I think it behooves everyone to actually have this broader, greater interest in trying to improve women's health.
Absolutely. Well, and you kind of described some of the change that we're starting to feel and see in the world here, but let's dive into that a little bit deeper and walk through
Mhm.
some of the biggest changes we've seen recently. Starting with the news that the FDA removed the black box warning on menopausal hormone therapy.
Right.
Dr. Choi, the U.S. Department of Health and Human Services invited you to be in the audience to celebrate this milestone in Washington. Can you walk us through what that experience was like, and more importantly, what it means for women's health and their providers?
Yeah, I think it was a very exciting sentinel event for women across the country. I was part of a larger audience of women's healthcare practitioners, and we were invited to come and represent. I was there to represent Progyny and our mission. But to hear the announcement that, let me just backtrack for a second. I think
Please.
um, most of us are probably familiar with menopausal hormone therapy or HRT, hormone replacement therapy. Interesting factoid, apparently before 2000, upwards of 25% of midlife women were on some form of hormone therapy. But then a really major, and actually, to be very fair, well-designed randomized control trial study was released right around the early 2000s. And my thought, there are lots of ways to look at history. It's so much easier with 2020 hindsight. But I think what happened is sometimes some individuals ran away, media ran away with some of the summary conclusions that were probably not applicable to women who are in early menopause or perimenopause. And I think it caused a lot of fear, not just amongst patients, but also their providers. And so the use of menopausal hormone therapy, hormone replacement therapy back then dropped precipitously. And even as recently as last year, I believe there was a Menopause Society poster study that actually calculated only about 4% of women in the US were on menopausal hormone therapy as of a couple of years ago, right?
Wow, quite a
And
decrease.
the reason why this is so important is menopausal hormone therapy, low doses of estrogen and progesterone if you have a uterus, can be very effective and impactful in improving quality of life for women who are suffering greatly from vasomotor symptoms, so hot flushes, night sweats, interrupting sleep, which can then downstream affect cognitive function and workability, home life, functioning, as well as it's a really useful tool in terms of trying to decrease the rate of bone loss and decrease the rate of osteoporosis. The scary thing I think that gave a lot of people pause was some of the snap kind of assessments of those studies from the early 2000s applied to a younger age population of women, right? And also this fear that it was going to, using these drugs might actually cause breast cancer and uterine cancer. So those black label warnings were on there, and also, dementia. And so what the FDA opted to do was, after consulting with their panel of experts, and also consulting with a lot of researchers and providers in the field, decided to remove a lot of that wording that was very scary. And really important to understand is that was the announcement, but takeaway was menopausal hormone therapy, if applied to the appropriate clinical use case. So it's still an individual patient having a very thoughtful conversation about their medical history, family history, and their records with their provider to see if menopausal hormone therapy is appropriate. But by removing some of the scary wording around it and reducing some of the highlighted risks, which probably aren't as prominent as what some of the older studies suggested in the right population, hopefully makes it seem more accessible to a larger population of women. And so that was a very exciting announcement. And my hope is that this will spur more providers as well as patients to have a conversation about this.
It's so interesting to hear. Earlier in the conversation, we touched on potentially social media and some of the media being helpful in giving a voice to maybe a population that didn't have a voice.
Right.
The opposite side of that coin is that if misinterpretation occurs in some of these studies and research, it can really lead to harmful effects, right?
Mm.
So, um, well, that's really exciting to hear. Um, I think another issue that we are hearing right now is about regarding perimenopause. And historically, that stage has been misunderstood or even ignored. What's changing in how providers are diagnosing and treating women in this stage, Dr. Choi?
So the background, that's a great question. So perimenopause is that period of time, and this is a little confusing to a lot of people, which can sometimes last years up until the year after menopause. So menopause is actually one day in the life of a woman, the day that's 12 months after her last period. But there are a whole slew of medical issues and symptoms that can occur for years beforehand and then even afterwards. So perimenopause encompasses that time beforehand as well as 1 year postmenopause. And it's highlighted for women who have regular or history of regular cycles, increasingly erratic cycles, hormone swings, and associated symptoms that can accompany them, like mood symptoms, cognitive, like brain fog, you would describe sleep disturbances and hot flushes. And I think what's really interesting is some of the recent studies that come out in the past 5 to 10 years have also highlighted the gaps for us to sort of learn from. One example is a survey that was conducted of the OBGYN residency programs in the United States. And so these are the providers that most women will turn to when they want menopause advice and help. Only about 23-25% of programs had said at that point, this is only a few years ago, that they offered any kind of official menopause training module in their 4 year residency program. And so I think that now there's been more of a press to improve provider education awareness around not just menopause, but perimenopause and what the appropriate symptoms are, conditions, and as well as interventions. And I still think there's a lot more room to grow and learn. But I do think that more and more women and providers are recognizing, hey, perimenopause is a time in life that's not atypical or abnormal, that can be managed and navigated with a great quality of life. You just need access to the right knowledge base and the right treatments, which can actually include things like low-dose birth control pills or a low-dose progesterone IUD. I think a lot of patients get confused. They're like, you sent me to a menopause specialist, but you put me on a pill. And we're like, absolutely, because you can actually still inadvertently get pregnant during a perimenopausal period. And the pill will not only contracept, but also help address some of the symptoms you've been sharing.
It seems like a recurring theme here of the value of having a strong relationship with your provider and having these conversations and open dialogue around them.
Absolutely.
Are there other meaningful shifts that you're seeing beyond menopause right now in this space?
I think it's, all of women's healthcare, but I think, a topic that's also still, and it's always been very near and dear to my heart, is family building. I know Kara also has a very passionate interest in this. So I want to segue into that. Back to the whole infertility, again, the World Health Organization only recognized it as a medical condition it wasn't in 2017, less than 10 years ago. It's a real medical issue. It is not, a nice to have benefit program to cover a few rare individuals. It affects 1 in 5 reproductive age women in the US, 1 in 6 individuals worldwide. 40% of the time, there is a male factor associated contributing factor to infertility, the inability to conceive without medical assistance. And I'm sure many of you have suffered through this yourself. And if you're listening, I am sorry. But I, fully recognize it is a very painful, sometimes long and arduous and expensive journey. So very excited about not only at least growing awareness about the need to cover it, at least to some degree. We're hearing about federal executive orders promoting more infertility coverage for Americans, more affordable fertility drugs. Again, we need to think about comprehensive delivery of this benefit because it is very complicated. And also increasing legislation around fertility preservation, especially. I'm going to segue over so Kara can talk about this too, around fertility preservation for young women recently diagnosed and treated for cancer, where oftentimes the treatments that are there to save their lives could increase dramatically their risk for post-cancer survival infertility. So that's a very important component too. I can go over the nuts and bolts of that in a second, but I wanted to have Kara weigh in as well on that.
Yes, Kara, we'd love to hear from you on that.
Yeah, I think that's a big one that's being recognized. I mean, that infertility isn't just confined to, a couple who wants to have a child that's having difficulty conceiving. I mean, I've been through that journey myself. My son actually is adopted, but it's also part of, and I mentioned it earlier, cancer treatment. Anyone of child before childbearing age, so men really anytime, um, women, even down to child blood, cancer treatment does destroy a lot of that tissue and the ability to have pop up children later in life. So even with younger children, preservation of ovarian or testicular uh, tissue for women who are already producing eggs, so things, egg preservation, or for men, sperm preservation. So those kinds of things need to be considered. You get told you have cancer, you have to make very quick decisions about the cancer treatment that you actually need to think right in that moment before you start your treatment about, do I need to do something to preserve my ability to have a family later in life? Because you have to do that before you started the treatment. And I think that's just now starting to become an area of dialogue. I mean, I haven't, fortunately, I haven't had to have that conversation with the doctor in my own case, but 10 years ago, no state covered fertility preservation, well, for cancer. Now, because of lobbying and awareness, 18 states cover it. 10 more that have legislation pending, including where I am right now, which is in the state of Ohio. So there is a effort afoot to get legislation adopted in every state to require cancer treatment to include under health insurance coverage to include the treatment of or the fertility preservation.
Well, it's real progress to see the states, picking up these policies. I mean, at least that's encouraging. I can't help but to think as we talk through all of this and you talk about infertility and the impact um, on the family, it's not just a medical diagnosis, it's like a holistic human impact, right? The mental health side of going through these journeys. Dr. Choi, anything to add to the infertility conversation, specifically related to women battling cancer
Yeah,
during childbearing?
absolutely. And actually, I have a few things. Just listening to what Kara was sharing, both about her personal experience and the legislation that's moving in terms of fertility preservation. So, one, really proud of, and this is a shout out to a small nonprofit called the Chick Mission. They're one of several groups. I'm on their medical clinician board or whatever you want to call it. But they've really been incredibly effective in trying to push legislation through at the state level to get fertility preservation covered, not only in some states for cancer, recent cancer survivors or newly diagnosed patients, but also for some individuals of chronic medical diseases like sickle cell disease who require the same sort of treatments that, for instance, breast cancer patients might need that will also increase their risk for infertility. So it's incredibly, I think it's a really, it's awe-inspiring to see this group, and their two leaders are both cancer survivors themselves, taking their own personal experiences and actually spinning a whole lot of good out of it too. And I can just tell you from the doctor's perspective too, I cannot tell you how impactful and meaningful it is, not only on that recently diagnosed breast cancer patient, for instance, to be able to say, hey, good news is even though you were just diagnosed with cancer, of coordinating with your oncologist, and my team has also ascertained that your benefit, your employer actually fully covers egg freezing. So here is one thing that you really do not have to worry about in terms of coverage. Am I going to be able to afford it? And the retort that I would hear over and over again from these patients was, thank goodness I'm able to do this. This is the one area where I actually feel like my life is not spinning out of control, where I actually have some hope. I have something to look forward to at the end of this really dark tunnel. So the gratitude, and so you're also impacting not just that person's life, but their future family's life as well. So I can't, that gain cannot be overstated. And then back to the whole fertility question is the importance and the necessity of actually highlighting, covering not just one aspect of infertility, like the diagnostic testing, or some of the medications, but not the whole IVF process for those who need IVF to build a family. But also acknowledging there's so many other ways to approach family building, including adoption, sometimes using donor eggs, donor sperm, gestational carrier, depending on what's going on in your life. All of those tools should be covered, in my opinion, and are sometimes, depending on the benefit design, but unfortunately not consistently, to enable anyone, any couple, to build the family in the way that they and their doctors seem appropriate. So I'm so glad, Kara, that you're able to share that, because I think too often people forget that adoption is another, again, definitely not easy. I'm sure you could share hours of stories with that. Definitely not easy approach to family building, but a very fulfilling one as well.
Yeah, very, very.
Absolutely. Well, before we move on to women's influence on healthcare, I'd like to do a quick round of myth versus reality with you, Dr. Choi. I'll share a myth, and then you give us a reality in a sentence or two, just a couple quick hits. Does that work for you?
It's great.
All right, let's dance. So, first myth: fertility is a women's problem.
Okay. That would have been my dad's answer, my late father, the surgeon's answer, but no, it is absolutely not. And I'm glad that actually you brought it up, because I, saw patients in the very recent past where they still thought, oh, let me just get my female partner all tested up, and then, we'll figure things out later. Like, no. If the two of you are working together, we need to get the sperm tested as well as all the other tests that are appropriate for fertility diagnosis and complete picture. And as I alluded to earlier in the conversation, at least 40% of infertility stems from some male health-related issue, sperm-related issue. So you want to pick that up as soon as possible.
Absolutely.
And there's no treatment that, by the way, as well.
Same thing with the archaic view that we actually determine the sex of the child.
Yes.
We're not talking Henry VIII times.
I know.
No. Hopefully, we're beyond that. Okay, round two. If your
Yes.
labs are normal, nothing's wrong.
Not necessarily so. I think labs are only one part of trying to get a comprehensive picture on a person's health. And so, and you also have to make sure that you're seeing provider who is not just looking at a set of labs randomly, but is taking into account your recent symptoms, your concerns, your family, and your past health history, what you're on. So they order the appropriate labs and know how to interpret them. But even if they're normal, and if you say, you know what, I'm still not feeling right, don't just say, all right, we're done. Keep on digging to figure out what's going on. And I also tell patients all the time, listen to your body. If you see a provider and they're like, everything looks fine, you're okay, and you don't feel right, then it's probably worthwhile still pursuing.
Once again, back to that relationship with the provider and having that open and honest dialogue.
Yep.
Okay, round three. Weight gain is only about diet and exercise.
I mean, I'm sure all of us can talk about this. Absolutely not. It is not just about diet, exercise. Weight gain can be attributed to different medications a person might be prescribed, underlying health issues. One that comes to mind that's very common is hypothyroid disease, so low activity in the thyroid gland, whole slew of other things. And it is not just about diet and exercise. Weight has a huge impact on, as we've talked about, cardiovascular disease, fertility, pregnancy health, and outcomes. It can go on and on.
And the last one, women's health now receives just as much attention as men's health. Do you guys even want to answer that one?
It is starting, well, in our household, I am overrun by men. And they're like, all we talk about is women's health. And I was like, great, you should be talking about it with your friends and colleagues. So it is getting more airtime and more conversation and more headlines. But I still think there are ongoing gaps. And I'm glad that we're working to try to address them. So the White House put out an initiative 2 years ago to divert more funding into women's health-related research. But as recently as a few years ago, the World Economic Forum and McKinsey put out a white paper and actually shared the huge discrepancy still in terms of the amount of funding that goes into product development and research for men's health-related issues like ED, and versus other chronic conditions affecting women like endometriosis. So I still think there is a divide, but I am hopeful that it is narrowing.
That's great. I guess to close this section out, I'm curious, where do you two think the biggest areas in women's health are being dismissed or delayed today?
the medications and what dosing of medications, a lot of those were still done on trials that were not sensitive to women in different stages of their life. So I think there's some opportunities there to kind of revisit and think about that with respect to what's the appropriate dose.
What's the biggest area of delay or dismissal from your perspective, Dr. Choi?
I'm going to answer it in two ways. One, I think it's still ongoing. I think a lot of it is provider related and where a person has access to. And also, there are disparities based on race and ethnicity. So there's studies showing that Black women will still be more hesitant to seek medical care because they're afraid of having their concerns as a previous expressed being dismissed by their provider. And we also see this in studies looking at, for instance, I saw a recent study looking at postmenopausal women post to fall. Um, Black women will be less likely to be offered, I believe the study said, a DEXA scan, which is a screen for your bone mass density, versus other women. And so there's still some of these disparities of care that we need to really take a hard look at and figure out how to resolve. And then the other side of the coin is sometimes also it's not just dismissal, but women getting taken advantage of because we are, if we have a medical need, we want to be able to fix it and move on with our lives. And so I'm always trying to caution friends and colleagues and patients about being very discerning of where you get your information, if it's on social media especially, and even with your providers, because I see far too often situations where women are being offered non-evidence-based, non-professional society guideline-based treatments that are probably not necessarily going to benefit their health and actually might be harmful. So you need to be very cautious.
That's perfect. Well, thank you. I think we'd like to shift the conversation a little bit to women's influence on healthcare now and spend some time talking about women's role as the decision maker in the household. Kara, you did a lot of founding research for quantum health, identifying gaps in the healthcare system, where members showed up in their healthcare journey. What stood out to you about the role women play as decision makers and caregivers in that research?
Women really, in the context of a family situation or even just a marriage, heterosexual marriage, they do tend to be the driver of that. They do tend to kind of be the one that pushes for somebody to get care and treatment there to at least go to the doctor. I mean, my father died when he was young, and my husband was the same age as my dad. And I said, "Have you had a colonoscopy yet?" Because my father died of colon cancer. He said, "No." I said, "Well, criteria of marriage, then in the first year you have to commit to get one." They tend to be the ones that advocate. I mean, women often do tend to put their needs aside for the needs of other family members, particularly if you have any family members that have very challenging healthcare issues.
I know just from my family, I have two little boys, a 6 and a 9-year-old, and a wonderful wife I've been married to for 10 years. And 9 out of 10 times, she's going to prioritize getting those boys to their, regular checkups or the dentist over getting herself into her OB or primary care physician visit. I think we just recently got her signed up for her own PCP. So it's so true, and it's so true for so many families out there.
It sounds stereotypical, and I don't mean to be stereotypical because I don't actually believe in that, but the research does bear that out.
Mhm. And how important is it to provide any decision maker, regardless of gender, with that personalized guidance and advocacy throughout that healthcare journey? What does that do in terms of changing the outcomes for everybody
Yeah,
involved?
it's really critical. The truth is that, nobody chooses to go on a healthcare journey. So it's fraught with danger, it's fraught with stress. When people are thrust into things against their will, their executive functions diminish because they are so stressed and that takes over. They're not used to interacting or the doctors are using terminology that's not well understood by the lay person. It's very important I think it's very hard for the patient themselves to be their own advocate. So it's important to have somebody else who can be their advocate. But it's actually really important to have an expert who can see everything that's happening. And, obviously for our company, we provide that to our members. But for people who don't have quantum health, I say, does anybody in your family or your friend group have medical experience? take that person to the doctor with you. Have them take notes. Have them ask questions. They're not there to get the treatment. Have your loved one there, have yourself there, but have this person who is tasked with, being clear-headed and listening to this, and then, has some access maybe to some resources that you may not otherwise get.
Dr. Trey, I'm curious on your perspective on that as a physician provider yourself. What kind of difference have you seen in members that had that support or, you know, social, support with them through the process? What have you
Huge,
seen in terms of
huge
outcomes?
impact. I mean, so again, the reason why I'm sitting here now working with Progyny is I was quickly convinced about the impact of a really well-designed, integrated benefit provider doing good in terms of having actually bigger impact than I thought I could have as a clinician, because I was seeing patients side by side, those which is more the norm without any coverage or paying out of pocket or with partial coverage or maybe some sort of, a dollar max kind of design, but there was no post-doctor visit, any kind of navigational support. And so the stress levels, and so there have been studies looking at the rate of depression and PTSD is definitely higher amongst fertility patients than the general population. So you combine that, as Kara was alluding to, like basically you have like the lizard brain and you have this medical issue, infertility, and you're desperate to try to have a baby before you run out of money. It's going to be very hard to make clear, truly shared decisions with your physician. And what I saw over and over again was that for the patients who had a navigator, whether it's through Quantum or with our Progyny PCAs, who were meeting with them even before they came in to see me, they were already teed up. They understood their health history. They oftentimes had their labs in hand. We had a much more personalized, effective initial consultation, could get them on the treatment pathway if they needed treatment sooner. And again, for those of you who've gone through egg freezing or IVF, it's complicated. It's like 10 days worth of daily hormone shots, sometimes twice a day. Timing is important. You can't just run downstairs to like some 24-hour store if you run on medications. You have to get a mail order shipment. And so time and time again, for patients who didn't have that navigational support, you'd have patients where they're like, oh, I'm missing my last set of drugs. And we'd have to either jerry-rig things, and the concern there was this compromising their outcomes, or just outright cancel their cycle after 2 weeks. Versus those who had coverage, everything was sort of well organized. Their PCA was reaching out in between all their doctor's visits to make sure they were on schedule, had the medications, and it just made for a much more low stress, complete journey. And that translated truthfully into better pregnancy outcomes too in many cases.
Just being teed up and informed to know what questions to ask and understanding a little bit more of what's going on makes such a difference.
Absolutely.
I'd love to hear from you both on what type of changes would you recommend employers making in terms of benefit plan design to prioritize the needs of women, as both consumers and decision makers?
I would say, even if you have a comprehensive suite of benefits available, I would probably, survey your female employees and say, are we really meeting your needs? And if not, what are we missing here? And the reason why I think that's important is we, our team did a survey with Donata last year, over 1,000 women, and the feedback was that there is definitely a huge divide between what women were hoping to get benefit support wise from their employers, like menopause support, pregnancy and pregnancy loss support, parenting support, versus what they actually said they were receiving from the employers. Meaning like, 80% of women valued all these benefits, but only like 15% said that they actually got them from their employers. And there are two issues to that. One, maybe their employers had it, but without a good navigator like Quantum at hand to help alert the member proactively that they actually have all these benefits at their fingertips, how would they know? So there's a communication issue. And then two, if you don't have them, really looking at your population of employees you're trying to best support and asking them, how can we best support you? I know that everyone is worried very much about the rising cost of healthcare, But I do think, and we could spend an entire other podcast talking about how having these kind of programs, the navigation, the really well-designed, comprehensive women's health support translates into cost containment and savings.
Absolutely. That's really insightful. I appreciate both of you and have really enjoyed our conversation today. I think as we bring it home, I'd love to talk a little bit about what the future looks like. What gives you the most optimism about where women's health is headed over the next few years? Dr. Choi, we'll start with you.
I think it's always exciting. I think there's more ongoing investment and interest in women's health at all levels: pregnancy, mental health, menopause. There's some exciting developments in the infertility world as well. Um, I also love the fact that there seems to be more of this grassroots effort from women who are just seeking more sound information and education and better understanding about their bodies, whether it's through wearable devices, they can understand what their vital signs really mean, and then taking it to their providers to sort of say, hey, what should I be doing about this, to like preventative health. That makes me excited. There's always there are always going to be bumps in the road, but I do think that's very exciting. I also find that, increasingly we're finding more and more employers and organizations are seeking to do right by their female employees, and really thinking thoughtfully about how to deliver really good comprehensive coverage for women's health.
And Kara?
And similar, I would say that I am glad to see that there's awareness or recognition of differences. I'm also glad to see, there's so many more free screenings. I think it's seeing women becoming more empowered.
And it's really exciting to see the women's health topic getting more of the airtime that it deserves. That's for sure. And I'd like to thank both of you for, again, taking the time today. You're both so insightful and inspiring, and really appreciate all of the insight you shared with us and our audience today. Any closing remarks, Dr. Choi?
I just want to say thank you so much for making the effort to really highlight the importance of women's health. And this is a thanks both to you, Chris and Kara. I really appreciate. I feel like we could talk about this for hours, but so glad that we had a chance to discuss this today.
Absolutely. Kara, any closing
Oh,
remarks?
thank you, Dr. Choi, for being here. I think the work that you guys are doing is wonderful. It's so needed. It's very sad to say that it is not as ubiquitous as one would hope. So I think it's great to see you take a lead on and to take on causes too, like keep nurtured. So I really appreciate that. And
Well said. Well, thank you again both very much. For all the listeners out there, I highly encourage you and everyone else out there to read Kara's book, No One Alone. You can order your copy today on Kara's website, karatrott.com. It is a really good read. I'd also like to quickly plug Progyny's Doc Talk podcast. It's a great series on YouTube. The co-host is Dr. Choi. So if you'd like to hear more from her, be sure to like and subscribe. It's definitely worth checking out. Every episode is highly informational, and it's a really fun watch. And then finally, I'd like to thank everyone who watched or listened today. If you enjoyed this episode, please share it with your friends. Be sure to like and subscribe. And we'll be back in a couple weeks with episode 2. We'll see you then.